Back, guys. It's Nathan again. We've got a special guest today, Roman Korchev. He's one of our patients and also a good friend of mine. And she's got a very interesting backstory regarding his teeth. So, Roman, tell us a bit about yourself.
Yes, I'm from Ukraine originally. I was born in Kiev, come to Australia in 1996. And from that time, I'm quite lucky I find Nathan dental lessons who can help me with my problems because they need to be put lots of attention.
A bit of a backstory about Roman. About 1986, there was a nuclear accident that happened in Chernobyl. Now, for the younger generation, which may not remember this, essentially Soviet scientists were experimenting and they pushed the boundaries too much and it ended up causing an explosion inside the nuclear reactor, and this huge plume of radioactive cloud was expelled into the air, and it pretty much polluted all parts of Europe. Roman, can you tell us a little bit about that whole story about the accident and how you were involved and the radioactive damage that occurred?
My family had the holiday house 200 km from the Chernobyl. On the day, 26th of April, myself and my brother were sitting and fishing. And later during this day, my mom came. And she said something going on. The road full packed with the people and they dress in pajamas, striped pajamas. And I don't know what it is. You just better stay together, get the taxi, and we get home. And after that, in 2 or 3 days later, we find out what's happened, and government tell us it's nothing dangerous happened, just to put wet linens on your window that will protect the wind blowing with the dust, but everything is okay.
So essentially, the authorities at the time weren't exactly being truthful to you, were they? They were, this was radioactive damage that was occurring, and you were in the middle of it.
Yes, they lied. They lied to everyone because they don't want to have a panic. People panicking and helping themselves in evacuating from the zone. However, it was an ecological disaster. And my mom at that time, she decided she will take us, well, her kids, and she will go for 3-4 months from Kiev to southern Ukraine, where we can, stay at the would stay with our family. However, my father refused it, and because he didn't want to lose job, and so my parents always it was, but we ended up going to the southern Ukraine, and we've been staying there for at least 3-4 months after that.
So there was an initial explosion. You were there. You thought about moving down south. And then you're a dancer, is that correct? Can you tell us a bit about the background dancing and how the authorities asked you to go back to Chernobyl?
I'm a professional artist. I have educated at Kiev Theatre Institute, and that time I used to work at theatre. But it was pretty much next year when our boss organized a performance for the liquidators. We just basically went there and entertained them with performances like Hamlet, and which is not really full entertainment, but anyway, it was like that. And we come there and we stayed around 3-4 weeks. Approximately, and we stayed near Chernobyl, pretty much 50k, and after that been traveling to Chernobyl by itself, and also we've been traveling around the military zones and military camps, getting into the 30k zone, which is what's most dangerous with radiation. That's what is pretty much lots of young military personnel were staying. And that story with the Chernobyl happened. And however, I think total everything is fine. It's not so dangerous. But Chernobyl's city, and it was pretty much ghost time. It was dirty because no one washing it. They didn't want the radiation dust escape into the water. And it was pretty much unreal, like a horror movie. And we came and we've been eating in the big eatery, and this big eatery had 2 massive dosimeters, which you need to walk through to the eatery place. And if you start beeping, they immediately collecting you, put it into the room, undressing you, put in new clothes. You need to have a shower, and after that, you can come back or you go into the hospital.
Roman, tell us how this radiation exposure affected your health at the time, there and then also 10, 15, 20 years later.
Well, after that happened, the first days and the second time when we've been performing at the Chernobyl, I started developing the metallic taste in my mouth. It was staying pretty much for 1 month. But after that, it's gone. I don't know what's happened. And doctors almost put us in a hospital because our radiation was a little bit too high. But before that, we've been offered to have a shower with alcohol, which is unreal. It wasn't vodka, it was a spirit, probably methylated spirit. However, after the second test, they used the big guns to point it into the thyroid gland to detect radiation. Doctor said, that's fine, your dose is fine, and you're okay. However, we'll find out later it was absolutely big lie, and the government not to tell people the truth to prevent the big ecological refugees from Ukraine at that time.
So it's had an effect on your health. Tell us a little bit about how it affected your dental health. My understanding was that it affected your salivary flow.
I had developed the dryness in my mouth. However, it can, because I developed the heart problem at that time, and some doctors believe that it can affect my heart as well. I had a valve replacement, 2 surgeries, and however, in combination with the radiation and the medication which I were taking, I was developing really, really dry mouth. And by the Nathan, he told me that the reason can affect my dental health in general.
There's 2 things that are important here. The heart surgeries, because that's a bit of an interesting story in itself, and also B, how the effects of the medication and the dry mouth will affect your teeth. So let's talk about the heart surgeries.
Sounds a little bit like a horror story, but I'm in it, and pretty much for me it was okay, and I developed the gratitude for the doctors who saved me. But at that time, I was told the first surgery that if I don't do anything, I will die in 1 month's time. That's how when they find out that I had a problem. And when after the first surgery, 210, doctors by accident put this golden stuff into my heart during surgery, and I didn't know about it. And I had a second time surgery, which almost died, and doctor at that time gave me 2% of the survivors to survive, which is pretty much miracle happens. But I pretty believe in that, but also in the professionalism of the medical personnel.
So Roman had, what was it, a leaky valve?
Yes,
a leaky valve.
Mitral valve.
A mitral valve. Okay, so there was an issue with his mitral valve. He'd gone into Australia to get that prosthetic heart valve replacement.
Yes.
And during the surgery, the clinicians at the time were not very hygienic, but somehow they managed to infect him with golden staph. Now, for the public out there that do not know what golden staph is, Staph aureus. It's a very, very lethal bacteria, and quite typically it's very resistant to several types of antibiotics. So it's pretty much almost a death wish. So Roman, after the first surgery, Roman was infected with this golden staph inside his heart tissues, and he survived for 6 months. And
for 1 year.
For 1 year.
Yes.
Apologies.
Not 6 months.
1 year. So 1 year was undetected, and he's floating around ill. Were you ill? Constantly ill?
Oh, yes. Yeah.
So it was constantly ill for about a whole year, and it wasn't until the cardiologist detected it.
What's happened when I started developing lots of water in my limbs, and I had a nausea, and I a little bit in kind of, sorry for my language, vomiting. Quite so often. However, at the time when I thought again to go to see my cardiologist, I wasn't well. I get a taxi, came to the clinic, to her office, and after that she just listened to me, had a very quick cardiogram, and after that she grabbed my hand and we walked across to the hospital, and she organized everything in 2 hours, my huge surgery. And it was like 18 people walking for 20 hours around me, and yeah, which is, that's amazing. I think it's only possible in Australia that such a professional surgeons can do medic.
A very unique perspective of this. He's very grateful for the cardiologists who have helped him out and get him out of the golden staph. But there's also an issue of, well, he got infected with golden staph. But that's, I'll leave that with Roman. So Roman managed to survive now, which is sensational. Moving on, we're going to talk about how it's affected your teeth. He's got a dry mouth. So for the public out there that don't know, when you have a dry mouth, specifically with medications, radiation damage, all that has contributed to him with a dry mouth. A dry mouth means there's no saliva. And when you have bacteria and food in your mouth, the bacteria is consuming the carbohydrate, spitting out lactic acid, and the acid eats away your teeth. The role of saliva is to wash away and neutralize the acids. And over time, if you have lots of saliva, you're going to neutralize it quite readily. However, if you have no salivary flow, then there's just an acid bath in your mouth, and essentially you're going to rot your teeth. And that's what's happened to Roman over the years. And his teeth have been destroyed, and we'll get some photographs and videos, and we'll show you that in a second. So, Roman, has it affected your mental health and anything else as well?
Pretty much every morning I was wake up during last 10 years, pretty much, a little bit more. Like I had a big night, dry mouth, need to drink water, need to do something. But at that time I kind of didn't know what's going on. But what's happened during COVID time as well, because I haven't had access to the doctors, to the dentist, it's actually speeded up my tooth deterioration. They start chipping away and all of that, not nice things. However, it actually affected me a little bit mentally, because I wasn't able to smile fully, because I was aware how people reacted to missing and rotten tooth, and also relationship with the females was quite difficult, because who wanna kiss a rotten mouse? I was lucky, very lucky, to talk to Nathan about it and Dental Essence, and yeah, he just offered his help. And as well, big part of that, it's a cost, because whatever my service generally it has a very big cost. However, Nathan and Dental Essence helped me to access my superannuation, which is covering my total surgeries and everything else. And I'm pretty much on the beginning of the great journey, which I have already resolved these tooth.
With Roman there, that smile that you just saw, that was a temporary denture, so it's not quite the final component of it. The plan was to remove all of his teeth. We've only removed half of his teeth, the top half, and also there was one tooth on the bottom that was removed, wasn't there?
Yes.
Yes, okay. So, Roman, has that affected your health as well? Because I remember speaking to you previously that it did affect your health. Is that correct? Because when you had all the teeth out, you felt a lot better?
Yes. I believe, well, that I was told that the infection in the gum can affect, go into the bloodstream and can affect my heart and all general feeling, my health. After that surgery for removal upper teeth, it's pretty much on a second week, I had a rheumatic kind of symptoms, not fever, but symptoms. And after that, I've been removed teeth, they're gone by itself. And also few other small things, which they quite detectable, and this has already helped. And I was really, really surprised to kind of understand how my teeth can influence all my general body health.
So what we're going to do now is we're going to show you some photos of Roman's teeth before. We'll even show you a 3D model of his teeth, and then you'll see exactly what we were dealing with. And the whole process, the treatment plan was to actually obviously extract all his teeth, and we had options of replacing his teeth. So we either replace teeth with dentures, and that was a possibility. But I advised Roman that with lower dentures specifically, there is a greater tendency for movements, and they flop around even when you're talking and even when you're chewing. So Roman said, no, he didn't want that. So, okay, then the other alternative is to put some implants down the bottom and support them with a prosthesis down the bottom. We were going to try and use a denture for the top teeth. Let's see how he goes with it. If he can manage with it, sensational. If he can't manage with it, then obviously we'll go further and we'll put implants, replace implants with a prosthesis up the top of there as well. So far, Roman, how are the dentures feeling right now, the top dentures?
Say the first 2 weeks sensational, that was really weird, but now I'm kind of healing. I start a little bit used to and start biting and eating. Yeah, but to have a good teeth and good it's like a huge difference. I even can't explain.
Your taste a little bit as well? Your taste experience when you're eating food?
Well, I can't taste pretty much on the top because my top covered with the plastic in the denture, but I learned that when I'm sending food on the right and left side, I'm sorry for details, I start having some taste sensation getting back. And also when I'm trying good red wine, I still have a good taste for that.
Thank you very much, Roman, for the time. Thank you for sharing your experiences, your personal experiences regarding your health and your teeth. With a lot of reconstructive work, when patients have a lot of destruction on their teeth, there's always a backstory. So either they've had lots of medical health issues, which Roman has, or there's some other story behind it, and it's quite interesting to see how, because at this day and age, the majority of people should have healthy teeth, healthy gums, if they're brushing and cleaning well. And if they're not, then there's medical issues that has affected the teeth. And Roman's case is very interesting backstory. So thank you very much, Roman, for your time.
Yeah, you're welcome. And I would love to add to that dental health, it's more than just dental health, because it's affecting mentally, making more people more confident, better breath, and overall, for last 3 weeks, my life is changing, which is, I'm really grateful. Thank you very much.